Hello everyone, my name is Dimanshu. Welcome to the channel GDC English. In this video, we're gonna have the drug transport mechanisms. All right. So in this drug transport mechanism, there are various kinds of drug transports. For example, paracellular transportation, as well as transcellular transportation, vesicular transportation, and many more above that. Okay. So we do have another kind of transportation which comes under the transcellular, just like passive transport and active transport. And if we call as the paracellular, if we talk about the paracellular ones, we do have the permeation through cells and the persorptions, isn't it? And if we talk about the vesicular types, we do have endocytosis, that is pinocytosis and phagocytosis. Okay, so this is the table of content that I have orally given you for this video. So let's get started. First, we need to understand what is drug transport. What is drug transport and why there is a need of drug transport? See, whenever there is an absorption of drug, what is the absorption of drug? Absorption of drug is called as when you have taken a drug through any kind of site of action. For example, you have taken orally, whether you have taken the transdermally, whether you have taken rectally, or whatever it is. From the movement, it is the movement. If we talk about the absorption, if we talk about the absorption, it is what? It is the movement of drug from site of action, site of administration to the blood circulation. Blood circulation. Alright, that is the absorption. Movement of drug from site of administration to the blood circulation. Okay. So there is a drug transfer. What is drug transfer? Because whenever you are going to move a drug from the site of administration into the blood circulation, there will be some barriers. There will be some barriers. For example, this is a stomach lumen. Stomach lumen. After that, there will be a cell membrane, various kinds of cell membrane, various cell membranes, and after that you will have your blood circulation, isn't it? Blood circulation. Now the drug have to pass from here to here, here to here, here to here. All right. So these need some transportation. All right. Just like we have to need some any kind of transportation to go to college from our home, isn't it? That is what the transportation means. So in the same way, drugs also needs any kind of transportation to reach the stomach or the intestine into the blood circulation. Right? So let's talk about some drug transportation mechanism. The first one is transcellular, that is also known as the intracellular transport. Okay. So this is the passage of drugs across GI epithelium. GI epithelium. All right. For example, this is a GI epithelium. All right. And the drug is going to pass from here to here directly. It will pass across through the GI epithelium, and it is one of the most major or most common pathway for drug transport. Okay. It is the most major pathway or most common pathway for the drug transport. It includes what? It includes passive and active transport, right? This includes passive and active transport. We will get onto it. Okay. So, all right. Now, first we do have passive. transport. Don't be confused with this with passive diffusion. This is not passive diffusion. It is passive transport. Okay. Passive diffusion is a part of passive transport. Okay. Passive transport process. So what it is? It does not require any energy. It does not require energy. That is ATP. Alright. Passive means passive itself signifies that it does not require any ATP. Okay. But it shows the Brownian motion. It shows the Brownian motion. Alright. It shows the Brownian motion through the this one, like this one. Okay, this through the zigzag of the Brownian motion. Alright. So there are different kind of passive transportation. First one is passive diffusion, very much known to you guys. Passive diffusion. Second one is pore transport. Third one is ion pair. And fourth one is facilitated, facilitated or carrier mediated. Alright. So there are four types of transportation in the passive transport process, that is passive diffusion, pore transport, ion pair, as well as facilitated or carrier mediated. All right. So let's move on to the next part. So we do have now the active transport. Active transport, in this active transport, there is a requirement of energy. Yes, there is a requirement of energy. Whereas it will be against the concentration gradient. It will be against the concentration gradient. The drug will move onto the against the concentration gradient. All right. That is low to higher. In passive, what was happening? High to lower. The movement of the uh, drug or the solute particles from the higher concentration of it to lower concentration. Here, active in active transport, there will be against the concentration gradient. There are two types of active transport. First one is primary active transport. The second one is secondary active transport. Okay. Primary includes the ionic ionic transport. Here it includes the secondary one is symporter and antiporter. All right, symporter and antiporter. Now let's move on to the next part. That is B first. B1. B is paracellular, paracellular or the intercellular transport. Paracellular or intracellular transport. Here, what is happening? For example, there are two types of GI epithelial cells. Okay. Now the drug passing through between the gap of it, not passing across the GI epithelium. It is passing through the gaps of the two GI epithelial cells. All right. So there are two types of paracellular ones. First one is permeation through tight junction of epithelial cells. Permeation through tight junction of epithelial cells. This is what happening here. There is a tight junction between it. There is a closely packed over each other, isn't it? So, but still, there may be a chance that drug can pass through these. That one is A and that one is B, and two types of cells, and they're closely packed to each other. But still, the drug is going to pass through the gap between it. All right. Next, now Second one is persorption. Persorption. There will be a permeation of drug. Permeation of drug through temporary opening formed by shedding of two neighboring cells. For example, there is a shedding. First, they have gone through the friction part, and there will be a shedding of the cells. And then there will be a production of gap. That gap is responsible for the drug transportation. All right. So let's move on to the next part. Next part is C, that is vesicular transportation. Vesicular transportation. Like active transport, here also the energy is required. Energy is required. All right. Energy is required. And these are further classified into first one is that is pinocytosis or the phagocytosis. Vesicular transportation is also known as the corpuscular transport as well as the endocytosis. See, these are the synonyms of the transportations. So these are also very much important. It can be asked that what is the another name of vesicular transportation? Option will be given as the endocytosis. So the correct option will be the endocytosis. Okay. Pinocytosis and phagocytosis come under the endocytosis. That question can be asked also under which these pinocytosis comes. So answer will be the endocytosis. All right. So pinocytosis is cell drinking. In Hindi we say that is pani pina. Pina. Pina is for pino. Pani pina, that is pino. So cell drinking. Okay. Phagocytosis is for cell eating. Cell eating. All right. Taking up the fluid part. Takes up the fluid part. And here it takes up the solid part. All right. Getting it? So let's move on to the next one. Now we will learn what is passive diffusion, which is one of the most important topics. Passive diffusion. All right. Passive diffusion is also known as passive diffusion is also known as the non-ionic equilibrium. Non-ionic equilibrium, no, non-ionic diffusion. Mark these points because these points which I am writing over here is very much important. All right. Sure. And it is one of the most major process because 90% of the drugs undergoes through it through the passive diffusion. All right. And the driving force is concentration gradient, which makes passive diffusion works. Okay, which makes passive diffusion works, that is the concentration gradient. All right, that is concentration gradient. Okay, now there's a law. There is a law that is fixed first law of diffusion. That is fixed first law of diffusion. So passive diffusion depends on the fixed first law of diffusion. What do it say? It do says that The rate of diffusion is directly proportional to the diffusion constant, surface area, partition coefficient, as well as the concentration gradient, but inversely proportional against the thickness of the membrane. Thickness of the membrane. So this is the rate of diffusion. This is the diffusion constant. This is surface area. This is the uh, partition coefficient. This is the concentration gradient, and this is the thickness of the cell membrane. All right. So it can be asked that passive diffusion depends on the which law? Fick's first law of diffusion. All right. Sure. Another one we have, that is pore transport. Pore transport is also known as the convective transport or the bulk flow or the bulk flow or filtration. These synonyms are very much important for you guys. Filtration can be asked, that is which pore transport or which transport is also known as the filtration. Which transport is also known as the filtration. Alright, so answer will be your pore transport. Okay, so there are some protein molecules. Do you know, whenever you have seen bilipid layer structure of cell membrane, there is a protein channels as well. Okay, what is it? Protein channels. Protein channels. And here the drug passes through it. The drug passes through it because of the hydrostatic pressure or the solvent drag. Greater the amount of solvent, the greater will be the chances of the drug to passes through the pore transport mechanism. All right. So this is the pore transport. Now let's move on to the ion pair. Ion pair transport. What is ion pair transport? So there are some kinds of drugs. There are some kinds of drugs which are ionized, in all pH. In all pH. For examples, sulfonic acids, sulfonic acids, propanolol, and sodium chromoglycate. So these are some drugs which are ionized at all the pH, whether it is 3, whether it is 6, whether it is 8, whether it is 12, whatever it is, it will be the ionized condition. All right. So, for example, the drug you have is of positive, that is cationic in nature. All right. And what will happen? There will be a pair. There will be a pairing of the inert substance. There will be a pairing of the inert substance. All right. Inert substance. And it will cause the pairing like this, P plus and negative. Okay, and this will transport towards the cell membrane and move on to the lumen part, and it will dissociate again. It will dissociate again. Positive drug and second one is ion. All right, and this complex have both lipophilicity and hydrophilicity. Okay, both have lipophilicity and hydrophilicity. Okay, so and the examples is that propanolol forms the complex with oleic acid. Oleic acid. All right. So let's move on to the next part. That is the carrier mediated. Carrier mediated transport. All right. So there will be a carrier. There will be a carrier. Carrier. But what is the nature of that carrier? There will be a carrier protein, which is the uncharged. Which is the uncharged. So if there is any substance which does not have any charge, then it will be called as the non-polar substance, isn't it? It will be called as the non-polar substance. One of the thing that is to be noted that these carrier proteins are very limited in body, and very limited in the body. Okay, that is at higher concentration, the drug response is, or the drug not response, if we talk about the transportation becomes saturable. Transportation becomes saturated. All right. So what was happening in the passive diffusion, because it was directly proportional towards the each other. So rate of absorption is directly proportional with the concentration. Okay, the dose of the compound. So it shows the linear drug rate of absorption. Shows the linear. But since the in carrier mediated transport, there is a use of carriers. There is a use of carriers, and they are limited in nature. They are limited inside the body. So there will be a graph like this. There will be a graph like this. All right. So here the passive diffusion was following the first order kinetics. First order kinetics. But here carrier mediated uh, is focusing on the mixed order kinetics. That includes until here the first order, and up to here it is zero order, zero order kinetics. All right. So this multiple order kinetics is also known as the Michaelis-Menten kinetics, as well as the non-linear kinetics. All right. Getting it? All right. So now let's move on to the graphical part. Graphical part. Yes. So we have discussed that is transcellular, which is also known as the intracellular. That is the most common pathway for drug transport. Yes, it is non-saturable, follows first order kinetics, and expressed by Fick's first law of diffusion. All right, that is the passive transport. Port transport, also known as the connective transport, bulk flow, and the filtration, suitable for low molecular weights. All right. Ion pair transport, the unionized ions and cations. These are the uh, sequence of which the drugs passes through the GI epithelium. Okay, all right. Now, carrier mediated diffusion, structure specific carrier, that is lock key arrangement, and there is a saturated transport and the mixed order kinetics. All right. So let's move on to the active transport. Active transport is of two types, that is primary active and secondary active. Primary active have the ion transport and the ABC transport. ABC transport is responsible for the removal of poison poison through efflux mechanism. Through efflux mechanism. All right. Ion transport. See what is happening over here in the primary active. That is, it is a unipolar in nature. That is, it is a unipolar in nature. That is, it allows one ion at a time and in one direction. All right. Unipolar. And secondary active, that is symport and antiport. Symport is for in the same direction. For example, same direction, allowing two ions in the same direction. That is co-transport. All right. An antiporter is just like the opposite of symporter. That is over here. One is going in this way and one is going in this way. That is the antiport. Okay. So what is paracellular? Permeation through tight junction of epithelial cells, basically through an openings. Examples are very important. That is insulin and cardiac glycogen. Persorption, permeation of drug through the temporary opening cell into lumen. Vesicular transport, this one. Pinocytosis and the Sabin polio vaccine. Already asked in your GPAT exam. Sabin polio vaccine, pinocytosis, phagocytosis, 𝘂𝙎𝙎, and as well as the insulin. Okay, so this is all about the theoretical part, and let's go move on to the MCQ part. So the first question, the most common mechanism of drug absorption across biological membrane is either it is active transport, facilitated diffusion, passive diffusion, or endocytosis. The answer would be the passive diffusion. Passive diffusion depends all of the following except lipid solubility of drug, concentration gradient, ionization of drug, or it is the availability of ATP. So passive diffusion is a passive transport, so it does not require any kind of ATP. It does not require any kind of ATP. Okay, so P-glycoprotein MDR efflux pump. Okay, efflux pump. I've just told you that is efflux pump is an example of this one ATP dependent efflux, that is primary active transport. All right. The mechanism of uptake of large protein like insulin when given intranasally is through the endocytosis. Endocytosis, particularly from the phagocytosis. Okay. So next move on to the next part. Passive diffusion follows which law? Fick's law, Michaelis-Menten kinetics, Henderson-Hasselbalch equation, Langmuir isotherm. No. So it will act on to the Fick's first law. Michaelis-Menten kinetics, that is when the carrier mediated transport. Alright, carrier mediated transport, that is Michaelis-Menten. Facilitated diffusion, which have feature in common with active transport. Okay, active transport. Common feature with active transport, that is carrier mediated, saturable, and competitive in nature. Some of the active transport also includes the carrier mediation. All right. So filtration, bulk flow of the drug act through aqueous phase mainly depends on. This is from the mechanism part. Filtration, bulk flow of drugs through aqueous pores depends on mainly on the hydrostatic or osmotic pressure gradient. All right. Yes. Which transport mechanism can be inhibited by the metabolic poisons like cyanide that blocks ATP? That blocks ATP. So it is active transport, particularly from the primary active transport. Primary active transport, which have the ABC, ATP binding capacity, channels, efflux pumps. What is that? Is efflux pump. Okay, so this is all about the video in which we have discussed about the drug transport mechanism, various kinds of drugs transport mechanism. Through in that only you will expect some of the questions for your examination. And I have also clear about you the MCQ parts. Okay, so till then, keep branding yourself and all the very best.